What is an implant restoration, and how do I know if I need one?
So, if a patient is going to lose a tooth and they opt to replace that tooth, an implant is the best way to do that. So, when you have an implant placed, that will help hold bone, so your bone doesn't resorb and go away over time, because that's what happens if you don't use bone, you lose it. So if a tooth is removed and that bone is not being used anymore, if an implant is placed in there, you're still using that bone. So then that bone will not be resorbed and go away. You will not lose that. So then you will need an implant restoration. So an implant restoration is the crown or the tooth that goes on top of the implant fixture. So the implant fixture is like the root part that goes in the bone. The implant crown or restoration goes on top and is the part that you see as a tooth. So anytime that you have an implant, you will need an implant restoration. That could be an implant crown if it's a single tooth. It could be an implant bridge if it's multiple teeth, or it could be an implant over, like an implant denture, which is a denture that attaches to implants.
What is the process for restoring a dental implant?
To restore a dental implant, you will need to come into the office. We would remove or unscrew the healing abutment that is on the implant fixture. We would place in a scan body, which is another little screw that we use to basically to scan your implant and your adjacent teeth so that we can fabricate the implant crown outside of your mouth when you're not there. So we need to scan the implant and the adjacent teeth, scan the bite, the way your teeth come together, and we'd also need to choose a shade, a color for your new tooth. And then we will put the healing abutment back on your tooth and you are able to leave, and we will fabricate the implant in your absence and then bring you back to insert it on delivery day.
Are implants or dentures better for a missing tooth?
Depends on how many teeth are missing. Sometimes we'll do a combination treatment where the implants actually support a denture if there's many teeth to be restored. If it's only one tooth, I would do everything in my ability to try to have an implant placed if it was my tooth, because implants are so good at holding bone so you don't lose bone. Also, they're the restorative option that feels the most like teeth to patients. So dentures are removable, so they come in and out of the mouth, whereas implants are fixed, so they stay in the mouth just as teeth do. Implants feel stronger and they don't move around in the mouth like dentures do. So I find that the satisfaction that patients have after getting an implant is very high. And so that's why that is my number one recommendation for people. The downside of implants is cost, of course. So patients are always concerned about that. I find more and more people are investing in it in themselves and getting the implant because they are deciding that that's the treatment they want. When they look at the pros and cons of both options, we still do dentures for people, absolutely. And cost is a big factor in that. Dentures are obviously a lot less costly, but they don't provide the same type of stability and security. Like they don't feel as secure. And so a lot of patients are looking for that tooth-like feeling. And there is a part that will have to go on your palate or around your teeth or your other teeth and hook on. So patients sometimes don't enjoy that, or it feels unnatural to them. So they prefer the implant restoration, definitely.
What does implant maintenance involve?
So maintenance for an implant would look like regular cleanings with the hygienist, regular checkups, generally an annual X-ray of the implant to check the bone levels. You're going to want to brush and floss an implant. Also, a water is a great tool to use around implants. So we really recommend a water pick for all our implant patients. It helps flush debris and keep the tissues nice and healthy. But importantly is to get regular checkups so we can detect any potential problems early. But generally, implants last a very, very long time and have minimal complications.
What does dentures maintenance involve?
Maintenance for dentures would include having your dentures professionally cleaned when you have the rest of your teeth cleaned, if you have other teeth, and having them checked, regular checkups. We need to check the tissue under the dentures to make sure that it's healthy, that it doesn't have there are no fungal issues or anything like that underneath. Dentures sometimes will crack or break. Sometimes there'll be a tooth that breaks off, or a crack in the acrylic and such. So sometimes there's repairs that need to be made in the lab that can happen over time. That's very, very normal. And, as the denture ages, especially, that's when those things can happen. But they still need to be kept clean, brushed at home, and taken out at night. They're not to be worn overnight.
Is everyone eligible for dental implants?
Most people can get dental implants. The caveat there is it depends on the amount of bone that you have in your jaw. So we want to measure how much bone there is. So we'll often send the patient for a cone beam CT scan to see the volume of bone that remains in the jaw to hold the implant. If there's insufficient bone, then the patient may be looking at a bone graft in that area if they want to have an implant placed. So there are some cases that, we just can't get enough bone in the area to accept an implant. But for the most part, with either using a bone graft or a sinus lift or whatnot, we can often get enough bone to place an implant.
What is the recovery process for dental implants?
So if there's an extraction taking place before the implant, like right before the implant, then, the tooth hasn't been missing for years, then the extraction is performed. And depending on the size of the tooth and if there was infection or not present at the time, there is a possibility that the implant could be placed same day. So that would be called an immediate implant placement after extraction. That usually happens in the anterior, the front, or the premolar region, not usually in the back, in the very back of the mouth, because the teeth are quite large there. So if the implant is not placed the same day, then usually you would have a healing period of about 12 weeks, at which time the bone would be evaluated to see if there was sufficient bone to place the implant. And if there was at that time, then an implant would be placed at that 12-week-ish mark. And then healing would take place, or osseointegration. So it's integration of the implant into the bone would take place over the next 3 to 4 months. And at that point, after the 3 to 4 months of osseointegration or integration of the implant into the bone, then we would get ready. We would start making the implant restoration, which is the crown that goes on top that you see as the tooth that attaches to the implant fixture, which would be like what you would think of as the root of the tooth. That takes a couple weeks to make it, fabricate at the lab, and you'll have that. So that part doesn't take very long. So a couple weeks, and you have your tooth on.